My name is Delaney Boyd, and the academic case study that I chose was Perinatal Neonatal Casebook. Neonatal transport: a 3-day-old neonate with hypothermia, respiratory distress, lethargy, and poor feeding. This case study was presented by Monica Joseph, MD, and Joseph R. Hangeman, MD, and published in the Journal of Perinatology in 2002. I chose this case study because I'm going into the healthcare field and am considering a career in neonatal nursing. This case study not only highlights how quickly an infant can deteriorate, but also the significance of early diagnosis and treatment to the survival of the infant. The two physicians present a study that discusses a 3-day-old infant that is suffering from hypothermia, lethargy, respiratory distress, and poor feeding. The infant was born at 37 weeks and weighed 5 pounds and 9 ounces. The pregnancy was unremarkable and the infant was delivered by C-section. The problem presents itself at day 3 when the infant begins manifesting symptoms of noisy breathing, grunting, hypertonia, and jitteriness. His rectal temperature was 97.7 degrees Fahrenheit, and blood pressure was noted to be elevated. Blood cultures were drawn due to elevated white blood counts and to rule out sepsis. Arterial blood gas results showed respiratory alkalosis. Lung sounds were wet, and the chest X-ray showed bilateral fluffy infiltrates. Due to abdominal distension, a orogastric tube was placed and 5 milliliters of fresh blood was suctioned off. The infant continued to decompensate, requiring intubation, and was placed on a ventilator. It was later determined that the infant had suffered a pulmonary hemorrhage. The determining factor in the diagnosis is the elevated ammonia level. Hyperammonemia is a metabolic disturbance characterized by the excess of ammonia in the blood. It is often the sign of an underlying metabolic disturbance. During protein synthesis, excess nitrogen waste is converted into urea through the urea cycle. Urea is produced in the liver, where the urea cycle converts 80% of excrete nitrogen. The 5 enzymes that make up the urea cycle are regulated long-term by the quantity of the protein in the diet. Disorders of any of the urea cycle enzymes lead to the accumulation of ammonia and its precursors. This can lead to the encephalopathy and death or devastating neurologic deficiency if not treated promptly. The case study goes on to state that most infants with the severe deficiency of the urea cycle enzymes presents with similar symptoms. The author identifies the clinical manifestations as poor feeding, weight loss, behavioral changes, irritability, vomiting, lethargy, and seizures, with the earliest symptoms of poor feeding and lethargy. The author suggests that hyperammonemia and inborn errors of metabolism should be suspected when a newborn presents with respiratory distress during the first several days of life. They go on to suggest that due to the severity of the outcome for the infants, an ammonia level should be drawn in the initial blood work. Hyperammonemia is a medical emergency. Intubation and ventilation is usually necessary to prevent hypoxia. Central blind placement is used to replace fluids. Hemodialysis is required to remove excess protein from the blood. There are 3 parts of maintenance therapy: protein-restricted diet, supplementation with ureic enzymes, and medications which provide an alternative pathway of waste to nitrogen excretion. These treatments may depend on the type of enzyme deficiency. Currently, the only way to correct the enzyme deficiency permanently is liver transplant. Gene therapy is a hope of the future. Specific genes for several of the ureic enzymes have been mapped and mapped to chromosomes 9 and 7. The outcome of this illness truly depends on the length of the hyperammonemia coma. If the coma is less than 2 days, then the neurological deficient are minimal. But if the coma lasts more than 2 days, neurological deficients are almost certain. If the comas are less than 2 days, then the neurological deficient are minimal. If the comas last more than 2 days, then the neurological deficients are almost certain. Since the initiation of the treatment, there has been 92% survival rate. However, many of those who survive experience mental retardation, seizures, cortical atrophy, and spastic quadriparesis. The author concludes the case study by emphasizing the need for early diagnosis and treatment in order to minimize neurological complications. Thank you.